the end of December, Congress passed and President Joe Biden signed a $1.7 trillion Consolidated Appropriations Act. It's a big spending package, also sometimes referred to as an omnibus, that funds the federal government for their next fiscal year. It averted a government shutdown right at the end of the calendar year, but it also included some changes to Medicaid and food programs. The biggest one being it created an end date to continuous Medicaid eligibility that had originally been tied to the national COVID public health emergency. So this whole time that we've been under the COVID National Public Health Emergency Declaration, states have received enhanced federal money to keep people enrolled in Medicaid, even if their eligibility would have otherwise changed, which meant that as long as there was a public health emergency, there was continuous Medicaid. The Appropriations Act changed that. It set an end date to continuous Medicaid eligibility as April 1st, 2023. States then have 12 months to initiate their unwinding process, which means all of those individuals held in Medicaid will be redetermined. Some will be renewed if they're still eligible. Some will be terminated. States have 14 months to finalize the redetermination process. So the spending package decoupled continuous Medicaid eligibility from the public health emergency designation. So we might see the public health emergency run further into 2023, but that's no longer going to impact how long somebody's going to be keeping their Medicaid eligibility. Some states said they're going to move quite quickly when they do the redeterminations. Other states have said they're going to take the whole time. It's important to keep opening your mail and listening to notices from your state Medicaid agency with an idea of when your renewal or redetermination might happen. In the state of Wisconsin, everybody's going to get a letter that has a renewal date or instructions of what their next steps are, and we're encouraging people to watch for that notice. The impact is quite large. The Robert Wood Johnson Foundation reminds us that about 18 million Medicaid enrollees could lose their health insurance. And at that time, they were saying once the public health emergency expired, and they were envisioning a mid-April deadline for that. Well, we're working under this new assumption that things are going to start changing as of April 1st. So of those 18 million people, nearly 4 million will become completely uninsured. It is now all of our jobs to make sure that people who should be connected to health coverage of some sort don't get lost in this transition. There may be options for you in your state to find local help as well. In the description below, we link to a couple of the resources and more information on the Omnibus spending package.